Hi, I'm Jennifer Honeycutt. I am the ICU educator at Seton Medical Center, Austin. With me today is Granai-Sisk, an ICU nurse as well here at Seton Medical Center, Austin, and Stephen Rosenthal. He is a physician assistant with the thoracic surgery group. The purpose of this video is to demonstrate proper setup in preparation for a chest tube insertion. There are 5 different steps. Your first step is going to be gathering your supplies. You will need to go to your supply area and get your chest tube insertion box. Plus, you need 2 pairs of sterile gloves in your size. Be sure you have your suction regulator hooked up to a canister with your suction tubing ready to go. At least 2 carts or 2 bedside tables, and either pillows or wedges, which will help get your patient into the correct position. And a quick review of the chest tube insertion box. It will be locked, so you will have to pull these off. Inside, all the boxes are the same. You'll have a prep tray bag, which has the contents that will be placed onto the sterile field. You have your procedure pack, which includes the drapes, ChloraPrep, gowns, dressings, and flushes. Your sterile chest tube insertion tray is what you will be getting ready for your physician. The sterile insertion tray is for standard chest tubes only. If your provider is going to be inserting a thaw-quick chest tube, the only thing you will need to have ready and available is the general purpose tray, which has your scissors, tweezers, and hemostats. And then the remainder are the different types of chest tubes that your physician will use. He'll select the appropriate one for insertion. There is also additional suction tubing and additional pairs of sterile gloves for your physician, a 5-in-1 connector, and we have a checklist for you that will help at the bedside.
You're going to get your procedure pack from your chest tube insertion box and your dry suction collection chamber. If you've opened your procedure pack, you want to lay all your contents out onto the table, so you have your gown, your gloves, mask, and hat, the drapes, the prep, and then your dressing change supplies. You're going to remove your dry suction collection chamber from the plastic packaging and set it on the table.
Okay, now we're going to don the sterile gloves. So open up your packet. You want to be sure that your fingers stay on the outer edge here to open up the packet. You're going to pinch your non-dominant, or excuse me, your dominant hand first. Put your sterile glove on. And just adjust accordingly. And you have your sterile gloves. Ding! Okay, so with your sterile gloves on, we are just going to open up the medicine cups so we can squirt some lidocaine. I have a trash can here next to me, so that way you can easily throw away extra contents with the wrapping. So I've unwrapped 1 or 2. Okay, and then you're ready for your assistant to help you withdraw some lidocaine, so you can squirt the lidocaine into one of the glass cups.
You've identified the items from the checklist, then you're going to drop them into the sterile field, naming them all. So this is a 22 gauge needle, 18 gauge needle, 3 10 cc syringes, a 15 blade and 11 blade. So this one is the 15.
All right, prior to the procedure, you'll want to identify with the provider which chest tube you'll be going with. Right now, we'll give you a brief overview of exactly what different chest tubes will be found in the chest tube insertion box. First chest tube is a standard chest tube, which is a straight chest tube that has a trocar in it. You can find the size right here. This will be used for hemothorax or large pleural effusion. The next set is the Thaw-Quick series, The French size is found right here. They come in sizes 10, 16, and 20 French. These chest tubes will need to be accompanied by opening the entire instrument tray as the first one that I introduced. And these will be used for pneumothorax and also can be used for fluid in the case of a pleural effusion as well. The last one that we have is a Wayne pneumothorax kit, and this is a pigtail. This will be used for a straight pneumothorax with no other complications in a thinner patient or a smaller patient. This comes in only one size of 14 French. Here's an image of the tray. This unit is completely self-contained with everything you need from silk to tie down the chest tube, lidocaine, needles, and the chest tube itself which is the pigtail.
The next step is to get your patient in the correct position. So depending on what side your chest tube is going to go in, you're going to put them in a left or right lateral decubitus position. You'll turn your patient here over to the right side. This leg will go forward, bent, and this leg is just semi-bent. You'll use your wedge or your pillow, whichever you have, to help support their side. Then you'll take the arm on the side of chest tube insertion and raise it up over their head. This will expose your chest tube insertion site, which is typically mid-axillary at the 5th intercostal space. And then once you've done that, you will raise your head of bed up about 10 to 15 degrees. And your patient is ready to go. After you have donned your second pair of sterile gloves, you're going to set up the chest tube collection chamber onto the sterile field. So you're going to open up the chamber sterilely, stand up your chest tube, and open the kickstand. You will remove the saline bulb on the back of the container, twist off the top, remove the tag that is in the suction injection port, and then you will inject your saline into the seed chamber, all of the contents, which will fill it to the 2 centimeter line. And your water should turn blue. Then you will carefully, once your provider or physician is ready to connect the suction tubing, you'll remove the cap and hand to him while maintaining a sterile.
Okay, at this point the chest tube's been placed, and the last step is to hook up the chest tube to suction. So we've got the chest tube on our sterile field here, and the chest tube's clamped. We'll go ahead and undo and expose the 5-1 connector. Make sure that this is seated well, and unclamp our tube, and again further ensure that we've got a good connection at the 5-1 connector.
Yep, we're going.
Okay, the next step we're going to take is turning on your suction regulator. You just want to turn it on to continuous versus the intermittent, and then dial between 80 and 100 millimeters of mercury. There you go. Okay, now we're going to hook up your suction tubing to these collection chamber. You should not see any bubbling down here in chamber C. If there is bubbling, that would indicate an air leak. And then your bellow should come past this arrow. And this is currently set at a -20 suction. This concludes our video on the RN role in assisting the physician in putting in a chest tube at the bedside. For additional reference material, there is a chest tube insertion and maintenance policy within Policy Tech. Thank you very much.